So welcome everybody. This is Dr. Madeleine Muller speaking. I'm a family physician from East London, CMH, and I'm doing the session for you guys on genograms and eco maps, which is very much a part of how family physicians, what we incorporate in looking after our patients. And I know some of you might not be using this much in the other departments, but I already want you to keep it in mind. So even if you're in pediatrics or internal medicine, even though they don't require you to draw up a genogram and eco map, sometimes it's quite useful to actually, especially when working with children, to be able to keep the family in mind. So when we talk about genograms, we're talking about a family tree, and a genogram actually is used as a clinical tool. And what we want to do is we want to be able to integrate all the information about this patient's family into solving this patient's medical problem. So the reality is when you're looking after the patient in front of you, you're not only trying to get them to manage a particular or diagnose or manage a condition, you actually have to help them figure out how to manage the condition in the context of their lives. And that very much includes the larger family that they're a part of. And being able to understand that gives us an amazing way to actually intervene for that particular patient. So it includes basic things. So a family tree will obviously have your basic family data. So your name, sort of usually we just do initials, the gender of the person, the date of the birth, and if they've died, the date of death. But it also then illustrates all the relationships, and it both illustrates family relationships, so who's married to who and who's brothers and sisters and uncles and also all of that. But it can also show the emotional and social relationships between those people. And it provides a way that helps us to map these family patterns, usually over at least 3 generations. So when you've got a patient in front of you and you're doing a genogram, we expect to see 3 generations. So for example, if it is somebody who has children, then you would want your patient, their children, and that patient's parents. If it's quite an elderly person, you might have that elderly person, their children, and their grandchildren. If you are looking after a child, then maybe it's that child and their parents and their grandparents. So when we look at a genogram, you can almost think of it as a skeleton of this family, and you can therefore diagnose problems when you look at the skeleton. So you might notice that part of the family is actually dislocated. So there might be a disowned child or a runaway person or a person who's no longer in the family. You might have families that's under massive stress, and there's a danger actually that things might even escalate into gender-based violence, or has already been escalating, for example, into violence. Or there might be issues like marriage relationships or empty nest phase when children leave the home, etc. And you'll also notice that a lot of our families are no longer just a simple nuclear family. There's a lot of divorces, remarriages, other relationships outside of the marriage, and all of these needs to be incorporated. And so you get a real quick snapshot of how this family is put together. So it's partly about putting a map down and getting an idea of this family, but actually for me, the biggest advantage of doing a genogram is actually the doctor-patient family relationship that you build up in that moment. So while you sit and draw this, you're actually listening to where your patient's at and getting to understand what their lives is like. And that's an extraordinary way to build rapport and trust with that particular family. It also very much helps you to understand a little bit where that family is coming from, which makes you more empathic and more able to also feel in terms of what's happening in this person's life. And the patient interprets that whole genogram process as an act of being listened to and cared for as a person, not just as a clinical case. So we always talk in family medicine about how we look after the person as a whole person and not just as a disease. And one of the most powerful ways of actually doing that is the process of drawing up the genogram, regardless actually of what you can do with the results afterwards. So when you are also completing a genogram, it also communicates to the patient that you're not only going to be addressing their clinical problem today. You're actually going to go look at what is the family issues, what are the psychosocial issues. So you're already framing your consultation as not just a consultation where we're talking about your illness, but we're actually going to talk about your life as a person. And therefore, I think always, we in the busy clinics, and for us as family physicians, we rarely have an opportunity to sit down and do a whole genogram. What I normally do is I gather little bits of information about the patient every time I see them, and you almost have a living genogram that you build up over time. But for you as students, you actually have the opportunity to sit down and draw up that genogram, and that's a very special, also for the patient, that's a very special part of that consultation, and actually is a real privilege that we are able to offer patients that. So this is one of those things that just shows us how we all integrate that. So if you're a physician in primary care, when you are dealing with serious medical illnesses, there's always psychosocial problems that are either making these worse or actually causing these or are complicated by these things. And being able to identify and manage all of these, so if you're able to manage your psychosocial problems, you're also going to better be able to manage your medical problems. So this is quite a fancy slide, and we don't get quite as in-depth, but this is the 6 specific categories that you could potentially cover in a genogram. Genograms are very often used in, there's 2 scenarios where they're most often used, the world of substance abuse. So in people who are care workers of people with substance abuse will often draw a genogram to understand the family support system, but also social workers use it a lot when they are looking after vulnerable children and orphans, for example. And so you have obviously your family structure that's in there. You will be able to identify the life cycle which each of the people in that genogram is at. You can start seeing if there are patterns across the generations. For us as doctors, we're obviously looking at medical patterns. It also helps to give us an idea of life events and family functioning, of how that family is operating. You can start seeing all the relationship patterns, so who's supporting who and where there's conflict, and also where there are areas of balance and an imbalance. So there's actually starting off with a very sort of basic skeleton picture, and then actually having a very dynamic understanding of a family can all be captured in your genogram. So the genogram is not only going to show the names of people, but also how they relate to each other, but you do want to start looking for patterns. And the kind of patterns we want to look all for is where is the strengths and resiliences as well as the dysfunctional patterns. So for example, if you've got a patient who's got HIV and you're going to look at things like adherence, you want to, for example, be able to identify who's the people in that family that could be potential treatment supporters. So it helps, therefore, what's also helpful is being able to look in terms of where somebody comes from, also helps us to understand a little bit where they are at now. So if you, for example, see that this person is now presenting with COPD and lung problems, and for example, one of the parents died from COPD, that already is going to affect on how the person is experiencing their illness and what they are thinking. But you can also see the way certain sort of emotional patterns might get repeated from generation to generation. So let's get into the practicalities. And the idea is first to have a piece of paper where you sort of roughly draw things in the rough in the beginning, and you're almost always going to have to redraw it. So families are quite complicated, and so in the beginning you just want to get roughly an idea of where things are at. And the first question you're basically going to ask is who lives together, who's in the household. So that gives you an idea. Sometimes it's a nuclear family in the household. Sometimes it might be somebody with a cousin. And you don't draw the lines in first. You just start getting an idea of who's the names, where's the ages, and then you can start looking at how they relate to each other. And you want to identify at least 3 generations. So you're going to ask your patient, do you have any children? So that'll be a generation below them. And you're going to ask them specifically about their parents, whether they're still alive or not. And that already gives you 3 generations. Once you've got all your basic people that's in the household, you can start seeing how those people are related, and then you can start looking at how the genogram will sit outside of their household. So what brothers and sisters and aunts and uncles are not in the household, but are closely related to your prime patient. In the beginning, you're going to try and get as much factual data. So it's simple things like trying to figure out the age, obviously the gender, but because we are doctors, we also want to start getting at things like the medical history. But you also want to start getting a little bit of an idea about the actual relationships within this genogram. So firstly, you're just going to record your, ages, date of birth, date of marriage, who's together, who's not together, etc. But then you want to start figuring out, now you've got this lovely map in front of you with a genogram, and you can ask your patient, well, who in this family are people that you get on really well with and is your support system? And is there anybody in this family where the relationship is more difficult, you know? And it's easier when you sit and discuss it with a nicely drawn map like that. I'm going to skip these 2 slides because that's more for in your substance abuse settings where that's useful. For you guys, please remember to fill in that emotional bond. I'm going to show you what that looks like in a moment. And when we draw a genogram, we're going to use symbols to put it all together. And we're actually going to be practicing on how one does that in a minute. But here's some of the main symbols. So any male person is going to have a square. A female person is going to have a circle. A triangle is somebody of unknown gender. So that is particularly useful if you've got, for example, somebody who's had a miscarriage, or there's a child that somebody's had that died when they were little and the patient doesn't know what their gender is. We're going to use a straight line when we're going to show that people are going to be married. I'll show you what that looks like in a minute. A dotted line if the relationship is not a marriage. So say it's somebody who's just either living together or maybe they are boyfriend and girlfriend. And because there's lots of varieties of that, you might write in, you know, cohabitation or whatever. If people are separated, then there's a single line through that marriage line. And if they're divorced, then you add in 2 lines and you'll put in the year of the separation or the divorce. There's lots of varieties of how you can denote if somebody's lesbian, gay, bisexual, or transgender. Certainly you can't, if you are going to use, and you can definitely make them up as you go along, quite a good way to do transgender, for example, if they are a trans man, so they identify as male, then you would use the male symbol because that is the gender that they are. But they were assigned female at birth, then you can, for example, put a circle in the middle, for example. What I would recommend in any of those kinds of cases, just denote what you mean. So if it is somebody that's a lesbian or a trans man or a trans woman, then just write that in. So you'll see with genograms, because there's lots of different, there's no sort of set rules where there's sort of general guides on how people do it, but there's actually quite a lot of variety. And so it's always just helpful to write in to specify if you have one of these more ambiguous symbols. So an important one you guys will use a lot as well is death. So if you have somebody that's died, then you put a cross through. And then very, very important is that you will draw a dotted line to show who the members of the household is. So in the bottom here, we've got a little example of what that will look like. So on the left here is a man, the purple box, and his wife is that green circle. And you can see this block here, you can see it's like a U shape. That shows that they are married and they've got 3 children. So the oldest one is a boy, so that's a square. The second one is a girl. So you can see this is 2 circles, and that's how you show who the patient is. So this is actually the patient that's sitting in front of you. So they've got an extra circle around them. And then the third person is another daughter. And you can see the oldest son has left the home, and they've still got 2 girls living at home. So in the household living together, that is that dotted line. And you need to always make sure you've shown that in your genogram. So this is just an idea of how you can show the children. So again, on the left here, you've got the man, and on the right here, you've got the woman. If this was all the children that they'd had, that would be an oldest boy, then there will be a girl. You'll always put the ages in. You can use unknown gender like this, or you could use your triangle, and you can see you can write in then something like pregnancy. If a child is adopted or a foster child, then you can use dotted lines. And again, please specify that. Obviously, if a child has died, you put a cross through. The same with miscarriage and abortion. Twins, those would be non-identical twins, and those will be identical twins. Yeah, I think, sorry, the bottom here is similar to the top one. I have sent round to Dr. Garcia, which I think she will upload onto the Moodle site, sort of a summary of all these symbols to use when you've got the patient in front of you. So this is just to show relationships, whether people are married. So that's that. And note that it's a box like that, so that you're then able to show the children that comes from that marriage. If they are separated, you still do a box, but you do a little stripe through it. If they're divorced, you've got 2 stripes through it. If they are widowed, then that person has died, and then you put a cross through that relationship. Cohabiting partners or non-cohabiting partners, the reality is it's very difficult to know whether people are making dots or little stripes, so just write it in, but it's not there for a straight line. Yeah, and then if you've got, let me just skip that because I don't think we get that detailed. What I do want to show you here is emotional relationships. So you can also see they've got all kinds of fancy ways of doing it. But in our setting, you're basically going to use the normal relationships. We'll have a line like this. But if you've got 2 people in the family that are very, very close, then you'll make 2 double lines. So that we use quite often. And if they have conflict or violence, then you make your zigzag lines. Again, the same problem is that it's very difficult when we hand draw genograms to know whether it's a violent zigzag or whether that's just a hostile zigzag. So write it in, just specify what the issue is with that relationship. And the same here. So abuse, trying to get fancy with the zigzag lines is not going to work. So you'll put the zigzag lines to show that there's a negative relationship, and then you will write in what that issue is. So if you want to get really fancy, you can put in little symbols into your either squares or circles, depending if it's a man or a woman, to show certain addictions or physical and mental illness. So if somebody's got a physical or psychological illness, you can fill in a vertical block like that. If they've got alcohol or drug use, you can fill in a horizontal block like that. But again, we don't use these very, very often, and usually you will write in what the illness is specifically. You can also specify smoking, obesity, language problems, but again, just write those in because people don't always understand the symbols. So great. So we're now going to do a little exercise. I want you each to take a piece of paper, and I want you to draw a basic genogram of you and your family. And most of you might not have kids. Some of you might have kids. If you don't have children, you're going to need to include yourself, your parents, and your grandparents, including their children, etc. I want you to draw a genogram as like to think about the household that you're like when you're at home in the holidays. So don't use your current living situation. Look at what it's like when you go home, and then that will be the household of who's in the household when you are not here. Can I first just check if anybody has any questions? I'm going to give an example. There's an example here of what a genogram would look like. I can't see hands or anything, unfortunately. I'm on a full screen share. So if you do have a question, just unmute. Otherwise, I'm going to give you 5 minutes, or 7 minutes maybe. Let's do it until 5:15. This should go fairly quickly because I think you know your own families fairly well. And just draw yourself a genogram for your families.